I can start. Okay.
My name is Wanda. I'm 13 years old.
My name is Samuel Tugli. I'm 17 years. I'm schooling at Tematech. Yeah, I'm Wanda's elder brother.
My name is Emmanuel Tugli. I from Hobo or Amasama area. Yeah, my son is Wanda.
I'm Nwachukwu Mary Jane, SNO, Senior Nursing Officer at RPS, the Contemporary Plastic Surgery. We are all both in Benz and then plastic surgery. Wanda is a patient referred to my ward from Benz unit. Actually, he has Benz.
It was electrical burns. Like I was watching a television, then the television was not coming. So I tried to go and turn the pole. I don't know whether there's a live wire around the pole. So the time I tried to take the pole and I hold the live wire with the pole. And the time I realized, before I realized I was on the hospital.
Yeah, I was in the house, and he was at the store watching television. So my dad asked me to go and bring him water. So as I was going, then I saw him standing at the back of the store. Then I asked him what was he doing there, and he said the area was not good, so he want to turn the pool. And I said okay. So as I was in the store, I hear like an electric shock. So I quickly came out and I saw him shaking there, and I quickly called my dad. So as I returned back, then I saw him lying on the floor. Then my father took him to the hospital.
From our place I from, Hobo, we came to Komianu, and the Komianu hospital. They put drip on him, and through that we came to Amasama, and Amasama to the dress and the place the fire touched, and from that place we came to Kolebu.
When he came to Kolebu, he was sent to the emergency section as an emergency, and the doctors at Ben's unit was called. He was also transferred here. Then the pain medication was given, and then wound dressing was done and thorough bathing, and the estimate of the burns was taken. And from there, we start treatment.
I feel bad, and it's not okay for me, and that time I don't find it easy. I cried, I cried, and that time I reached hospital. I cry.
Actually, when they come like that, he's currently amputee, but we don't just amputee. We have to monitor the level of improvement on the bends and the extent the bends have gone. So the two hands we are monitored, and we notice that there's no blood secretion, and then the peripheral nerves are no more working, and the place is becoming gangrenous, and then he need to take uh, above the elbow amputee of both hands, and then the leg, one of the leg was also cut off. After which he was transferred to RPS, and he have already been transfused serious pints of blood. So right now he's stable. He's stable by our own observation. Then we do every 3 days dressing for him, observing the wound and then the improvements based on the healing aspects. But he will also be going to theater for grafting some part of the wound, which cannot heal on its own. And then the amputee have to be covered to make a storm.
The first year, at the time I saw that they've removed my hand and my leg, I was very sad of that, but I understand the way they did it because the way the electric passed through the legs and the hands, I saw that it was very scattered. So it was very scattered. So I need that they need to cut it off. So I understand the way they did it.
Because the problem I have now is his two hands that are cut off. That's my problem. I don't know how we are going to manage it, but we put or trust everything on God, that God will do everything.
I feel sad when I look at the other patients, like the way they are around, like there are very wounds, plenty wounds around them. So I feel sad, especially the kids. The way they are going through pains, I feel sad of the kids. So
Being a Benz patient, he is admitted in a ward where other Benz cases are. So he will see that he's not the only one being affected. Other patients who also have the same similar conditions are there. And then in the hospital environment, at the first stage, they are depressed. They don't eat well. So we pass NG tube to make sure he gets enough food for nutrition aspect, which also help in the healing aspect of the wound.
also, yeah, there are many malarias around me. So I feel the normal environment. I want to go to my normal environment. Like I feel to stay with my parents. And I feel to stay with my colleagues around the school. So I want to go back to home.
But the moment he got this problem, he's crying for his hands and a leg that, oh, what I'll do before I go to school to write or learn. So at any time he has crying, so that make me to feel bad.
When I feel sad in the hospital, I put my mind on something that makes me happy, like the way I go back to school, my friends we play together, we joy together, and my family too. Then when I sit here and I feel sad small, when my father come around me, then I'll watch some small videos, or maybe I can tell some of the nurses to turn, like to change the channel so that I can watch some cartoons or some war film to make me happy small.
In his future, I'm scared he'll not lose his life and how his hands and his leg has been cut. I don't feel happy about it. And how he used to dance, play ball, he can't do it anymore. So I'm very sad.
The hospital bill, the up and down, buy medicine, dressing items, everything is money. So the money we borrow from some banks and making this up and down, now there is a problem. But how for we are managing, we are praying that God will help us to pass this through.
Wonder at the age and the family he comes, he will need a lot of financial help and then support, not only actually this stage, because even if Wonder is discharged from Kolebu as per a hospital aspect, he will be coming for dressing. He needs other aspects of life to know where he will adapt. We that have hands and legs, many people find it difficult to get job and get even quality education. How much more a young guy of him from the poor family he comes? So he will really need some aspects. So if there's any way get a work or something that he can fit in with the both hand amputee, so that in future he will not be a liability to anybody. It will be welcomed, and it's a very good thing for his life.
The teachers, their madams loves him so much. And then last the thing happened, they all donate 500 Ghana to us to help the hospitals, medicine, other things, everything.
Yes, as for my family and my friends, I've missed them very well because that's why I'm forcing myself to go back to school to play with my friends so that I can get, like, we can be still friends. Like, I should have some fun or some joy to make myself happy.
Hello, my name is Elizabeth Yeboah. I'm a clinical psychologist at Kolebu Teaching Hospital, plastic surgery to be specific. I'm here helping Wanda to come out of his psychological issues with the amputation. It is a huge burden having two upper limbs cut off and one lower limb off. It's not easy. That traumatic effect is so much on him as a patient and on the family as well. So as a psychologist, I try to help him build his self-esteem because body image issue has been affected and he's no longer comfortable with the image that he had. So there's body dysmorphic, and the family too is burdened because he's now a dependent on them. He needs them all around just to help them do everything. So as a psychologist, we try to build the self-esteem, we try to work on body image, and thankfully, and we've able to help him use the foot to write. So he's using the foot to draw, use the foot to write, and he's now becoming independent being by using the techniques that we've taught him to wear his clothes by himself and the rest. But going on, it will be prudent if he gets the prosthetic arm and leg. Just that it's not just any prosthetic but functional. Even though he's using the foot to write, in our setting there's no educational setting that's going to allow him to use the foot to write. It will be a problematic. So if he can get the prosthetic limb that is functional, that will help him to write and go back to school. It will be very prudent. So I'm appealing that everybody comes on board, hands on deck, so that we can help him be functional and not be dependent on anybody. Sorry. Thank you.